Have you ever wondered why our moods fluctuate and sometimes it feels like they're out of our control? Now imagine if these mood changes were so intense that they started to interfere with your daily life, relationships, and overall well-being. This is often the reality for those living with mood disorders. Mood disorders represent a category of mental illnesses that significantly affect a person's emotional state over an extended period. These aren't just fleeting emotions. They are persistent, intense, and often overwhelming feelings that can disrupt a person's life. They're more than just feeling sad on a rainy day or being overly excited for a weekend getaway. Mood disorders are profound, lasting changes in a person's emotional state that can impact their ability to function normally. There are several types of mood disorders that we'll be touching on today, each with its own unique characteristics and effects on a person's life. The first is depression, a condition characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in things. It's not just a case of the blues, it's a serious illness that can affect every aspect of a person's life. Next, we have bipolar disorder, a condition characterized by extreme mood swings from manic highs to depressive lows. Those living with bipolar disorder may experience periods of feeling overly joyful and full of energy, followed by periods of intense depression and despair. Lastly, there's seasonal affective disorder, a type of depression that's related to changes in seasons. It typically starts in the fall and continues into the winter months, sapping energy and making you feel moody. These are just a few examples of the many forms mood disorders can take. They're complex, often misunderstood conditions that can have a profound impact on a person's life. But with understanding and the right approach, they can be effectively managed, and those suffering can lead fulfilling, happy lives. Understanding mood disorders is the first step in addressing them and creating a healthier emotional life. Depression is a word often used in casual conversation, but what does it truly mean in the context of mood disorders? Well, let's delve a bit deeper into that. Depression is a mental health disorder that is characterized by persistently low mood, a strong sense of despair, and a general loss of interest in things that once brought pleasure. It's like being stuck in a deep, dark well with no ladder to climb out. It's more than just feeling blue or having a bad day. It's a serious condition that permeates every aspect of life, from how you feel to how you think and behave. One common characteristic of depression is an overwhelming feeling of sadness. This isn't your typical sadness that comes and goes with life's ups and downs. It's a constant, unshakable feeling of despair that makes it hard to function and enjoy life. Another telltale sign is a loss of interest in activities. Things that once brought joy, pleasure, or satisfaction no longer do. This could range from hobbies, social activities, and even physical intimacy. It's as if the color has been drained from life, leaving everything dull and uninteresting. Depression also makes it difficult to perform daily activities. Simple tasks like getting out of bed, eating, or going to work can become monumental challenges. It's not due to laziness or a lack of willpower, but rather a symptom of the disorder itself. It's important to understand that depression is not a sign of weakness or a character flaw. It's a medical condition that requires attention just like any other health issue. It's not something that can be willed away or ignored until it gets better. It's a serious, pervasive disorder that affects millions of people around the world, irrespective of age, gender, or background. Depression can be a debilitating condition, casting a long, dark shadow over a person's life. But the good news is, it's not a life sentence. With the right help, whether it be therapy, medication, or a combination of both, depression can be managed. Depression is debilitating, but with the right help, it can be managed. Remember, it's okay to ask for help. It's okay to reach out. You're not alone in this journey. Imagine experiencing the highest highs and the lowest lows with little control. This is the reality for those living with bipolar disorder. Bipolar disorder, previously known as manic depression, is a mental health condition that is characterized by extreme mood swings. These mood swings include emotional highs, known as mania or hypomania, and lows, or depression. In a manic phase, an individual might feel elated, full of energy, and unusually irritable. They may also have racing thoughts, talk rapidly, and engage in risk-taking behavior. This can lead to reckless decisions that may have serious consequences. On the flip side, during a depressive phase, they may feel sad, hopeless, or indifferent. They might have trouble sleeping or sleep too much, have a poor appetite, and struggle with concentration. These two phases are distinct and intense, and they are not a simple case of feeling good or feeling bad. They can significantly disrupt an individual's life, affecting their ability to function in their daily activities. It's important to understand that these episodes can last for several days, weeks, or even months. The severity and frequency of these episodes can vary widely from person to person. Some people may experience more depressive episodes, others more manic episodes, and yet others may have a balance of both. Bipolar disorder is not a rare condition. In fact, it affects approximately 1 in every 100 adults worldwide. Even though it's common, it's often misunderstood. Many people mistake the symptoms of bipolar disorder for character flaws or personal weaknesses. However, it's crucial to remember that bipolar disorder is a real, biologically based disorder. It's not a sign of weakness or a lack of willpower. People with bipolar disorder can't snap out of it any more than someone with diabetes or heart disease can. Bipolar disorder may seem overwhelming, but understanding it is a step towards managing it. It's a lifelong condition, but with the right treatment and support, individuals with bipolar disorder can lead fulfilling, productive lives. So let's continue to learn, understand, and support those who are dealing with this complex condition. Bipolar disorder may seem overwhelming, but understanding it is a step towards managing it. Do you ever feel down during certain times of the year, especially during winter? You might be experiencing seasonal affective disorder. Seasonal affective disorder, often abbreviated as SAD, is a type of depression that comes and goes with the changing seasons. It's not just a case of winter blues. It's a real, diagnosable mood disorder that affects millions of people around the world every year. Most commonly, SAD symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody. It manifests as a feeling of fatigue that just won't go away, a persistent low mood, and a lack of interest in activities you once enjoyed. You might find yourself sleeping a lot more than usual, experiencing changes in your appetite or weight, and feeling sluggish or agitated. Social withdrawal is another significant symptom of seasonal affective disorder. It's not that you suddenly don't like people. Instead, it's more about feeling like you don't have the energy or the will to engage in social activities. This can make you feel isolated, which in turn can exacerbate the feelings of depression. It's important to note that while winter onset SAD is most common, some people experience symptoms in the spring and early summer too. This is known as summer onset SAD, and its symptoms can include insomnia, poor appetite, weight loss, and agitation or anxiety. So, why does this happen? Well, while the exact causes of SAD are still unknown, it's believed to be linked to reduced exposure to sunlight during the shorter days of the year. This could affect your body's internal clock, leading to feelings of depression. It could also lead to a drop in serotonin, a brain chemical that affects mood, and an imbalance in melatonin, which plays a role in sleep patterns and mood. Remember, seasonal affective disorder is more than just disliking winter or summer. It's a serious condition that can have a significant impact on your quality of life. If you're feeling down for days at a time and you can't get motivated to do activities you normally enjoy, it's important to reach out to a healthcare professional. Seasonal affective disorder can be isolating, but with awareness, it doesn't have to be. Now that we've understood what mood disorders are, how can they be treated and managed? Well, the answer is multifaceted, because the approach to treating and managing mood disorders depends on the individual and their specific diagnosis. There are several avenues to explore, including medication, psychotherapy, and lifestyle changes. Let's begin with medication. It's important to remember that medication doesn't provide a cure, but it can help manage symptoms. Antidepressants, mood stabilizers, and antipsychotic medications are often used to help regulate mood, anxiety, and depressive symptoms. Each individual responds differently to medication, and it may take time to find the right dosage and type for each person, which is why it's crucial to work closely with a healthcare professional throughout this process. Psychotherapy, often referred to as talk therapy, is another common treatment method. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that teaches individuals how to recognize and change harmful thought patterns that lead to mood swings and depressive symptoms. There's also interpersonal therapy, which focuses on improving relationships and social functioning to help reduce stress and improve mood. Now, let's talk about lifestyle changes. Regular physical exercise can boost your mood by releasing endorphins, the body's natural feel-good hormones. A balanced diet can also contribute towards better mental health. Getting enough sleep is crucial too, as lack of sleep can exacerbate mood disorders. Mindfulness and relaxation techniques, such as yoga and meditation, can also be beneficial. They can help individuals to become more aware of their mood swings and triggers, and teach them how to manage stress in a healthy way. Lastly, let's not forget about the importance of social support. Connecting with others, whether it be family, friends, or support groups, can provide emotional assistance. It's important to remember that it's okay to ask others for help and lean on them during difficult times. All these elements, medication, psychotherapy, lifestyle changes, and social support, can be combined in different ways for each individual to create a comprehensive treatment plan. However, it's crucial to emphasize that seeking professional help is the most important step in managing mood disorders. A mental health professional can provide a proper diagnosis, guide you towards the best treatment options, and offer ongoing support during your journey to better mental health. It's also important to remember that treatment takes time and patience. Progress may be slow and there may be setbacks, but that's completely normal. It's all part of the journey towards healthier mental well-being. In conclusion, while managing mood disorders can be challenging, it's important to remember that you're not alone and help is available. Treatment and management are possible, and they begin with reaching out for help. Why is it that despite mood disorders being so common, they are often misunderstood and stigmatized? This question poses a poignant challenge we face in today's society. Mood disorders, whether it's depression, bipolar disorder, or seasonal affective disorder, are a part of our human experience. Yet they are often met with judgment, prejudice, and misunderstanding. This is the stigma we talk about when we refer to mood disorders. It's an invisible barrier, a societal shunning that makes those affected feel isolated, misunderstood, and at times, even blamed for their condition. This stigma doesn't just come from society at large. It can also be internalized by those with mood disorders. They might feel shame, guilt, or a sense of inadequacy because of their condition. This internalized stigma can be just as damaging, leading to self-doubt and even preventing individuals from seeking the help they need. So, why does this stigma exist? A large part of it comes from misconceptions and lack of understanding about mood disorders. Many people still mistakenly believe that these disorders are just a sign of weakness or a lack of willpower. They see them as something that can be overcome simply by pulling oneself together. But this couldn't be further from the truth. Mood disorders are complex conditions that involve changes in the brain's chemistry. They are not a choice, nor are they something that one can simply shrug off. This is where mental health awareness comes into play. By educating ourselves and others about mood disorders, we can dispel these harmful myths. We can create a society where those affected feel understood and supported rather than judged and isolated. We can also encourage empathy and understanding by sharing personal stories and experiences. It's through these shared human experiences that we can truly see that mood disorders are not something to be ashamed of, but rather a part of our shared human experience. Mood disorders are not a sign of weakness, they are a sign of being human. Let's remember this, and let's strive for understanding, acceptance, and compassion in our approach to mental health. We've learned a lot about mood disorders today, haven't we? Let's take a moment to revisit what we've covered in case you missed anything. We started by understanding what mood disorders are. They're a group of mental health conditions that affect a person's emotional state over a prolonged period. They can drastically influence how someone feels, thinks, and behaves, and they have a significant impact on the quality of life. We then looked into depression, a mood disorder marked by persistent feelings of sadness, loss of interest, and a sense of hopelessness. It's more than just feeling blue. It's a serious condition that requires attention and care. Next, we explored bipolar disorder, a condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. We learned about its unpredictability and how it can disrupt a person's life. We also shed light on seasonal affective disorder, a form of depression that's related to changes in seasons. It usually begins and ends at about the same times every year, affecting people in the colder months. In our discussion on the treatment and management of mood disorders, we learned that these conditions are treatable. With a combination of medication, therapy, lifestyle changes, and social support, individuals can manage their symptoms and lead fulfilling lives. Finally, we discussed the stigma associated with mood disorders. We learned how misconceptions and stereotypes can harm individuals dealing with these conditions, making it harder for them to seek help and accept their condition. We emphasized the importance of understanding and empathy in breaking down these barriers. In essence, mood disorders are complex conditions that affect millions of people worldwide. They're not a sign of weakness, and they're not something that can be overcome through willpower alone. They need understanding, care, and proper treatment. Remember, Understanding is the first step to acceptance, and only with acceptance can there be recovery. Subscribe, and don't forget to take care of yourselves. Goodbye.